Okay, so today we will tackle our anatomy of the eye. No, anatomy of the eye. So first we will start with our external eye structures. First among our external eye structures is actually seen here. Uh, wait here. Kini siya. The outer layer of the eye. Oh, the outer layer of the eye, also known as your sclera. Okay, your sclera. Now the sclera is the what we call outer layer. Outer layer. It is oftentimes considered the white of the eye. Okay? Mao na siya ang white of the eye. Next, among which is not also visible here, but visible here. Kini siya. The front part, kini. We call that the, kini siya na part, no? The front part that bulges the eyes, no? We call that the cornea. Okay? The cornea. Okay? The cornea is the transparent and outermost. Okay? Mo gini siya ang pinakagawas. Okay? Outermost layer of, paminaw mo ha, the anterior or front of the eye. Anterior eye. Okay? Anterior eye. It helps, no? It helps focus light into the retina. Into the retina. Ayan, retina. Okay? Next is our conjunctiva, no? Your conjunctiva, it is here. Nagyapon nga rin sa sud, no? Kini siya. Okay? Kana siyang red. Okay? The conjunctiva is the what we call transparent membrane covering the sclera. Okay? Conjunctiva is the transparent membrane. Transparent membrane covering the sclera. Now what we mean by that is this. Kita mo nang if you pull your eyes, no? If you pull your eyelids down and you look up, kita mo na murag red na part sa imong eyelids. That is what we mean when we say our conjunctiva. It is transparent, no, but what we usually see is red because behind our eyelids red man na siya because it is highly vascularized. Okay, next is our eyelids. Okay, ini atong eyelid, upper and lower. Eyelids are also known as your palpebra. Okay, palpebra. Okay, now kini siya mo ni siya tong eyelids kani. Ayan kana diha. Yan, kana. Muna siya, no? Itong eyelids. Now, the eyelids, class, along with your eyelashes, kini sila mga buhok, mga eyelashes, no? Their purpose is very simple, class. Eyelids and eyelashes. Okay, eyelids and lashes. Okay? Eyelids and eyelashes. Their purpose is very simple, class. Its purpose is number 1 to protect. Okay? Protect the eyes from dust and debris. Okay? Protect the eyes from dust and debris. Ayan. And lastly, among our external eye structures is our lacrimal gland and our lacrimal canal. Okay? Our lacrimal gland is the gland that produces what we call our tears. Okay? Produces tears. Mo na siya, class, kana mohilak na, class, no? It is the one that produces tears. Now, normally class, no? The tears will come out here, maggawas na sila, and it will spread over the eyes, no? To lubricate the eyes. Okay? Mo na siya ang purpose sa tears, no? To lubricate the eyes. Your tears will drain. Okay? Ang imong tears mo drain into your lacrimal canal. Okay? That is the reason why, no? Your tears will drain into your lacrimal canal, and your lacrimal canal is connected into your nasolacrimal duct. So padong na siya sa imong nasal cavity. It is going to your nasal cavity. That is the reason why when you are crying, naana siya accompanying na maganaana ka. Hilak ka, di ba? Because the tears are draining into your nasolacrimal canal. Okay? Nasolacrimal duct, no? If for example class, this canal gets overwhelmed, grabe na kikaghilak na puno na ni siya class. If this gets overwhelmed, kana bitong to the point nga nag-traffic na diri dapit nag-traffic na, it will overwhelm the lacrimal canal, and instead of draining here, the tears will fall. Mo na siya makita nimo gahilak ka. The tears will fall out of the eyes, and mo na siya makita nga gahilak ka. Okay? Next is our internal eye structures. Okay, this is very important. You have to listen to this. Okay? First is our iris. Now, our iris is a muscle, otherwise known as our iris muscle. Iris muscle. Our iris muscle is the colored part of the eye. Okay? Colored part of the eye. Okay, kini siya class. Kita mo ni ka kining brown. Kana siya, that is our iris. Okay? Its function is it controls the pupils size. It controls the pupil size. Thus regulates the amount of light that enters. Light that enters. Okay, thus it regulates the amount of light that enters. Okay. After that class is what we call our pupil. Kini siya diri dapit. The pupil is the black part of the eye. Kita mo ani? It is the black part of the eye. Simply put class, the pupil is just an opening. It is an opening. Opening. Okay? Black circular opening. It allows light to enter. Okay? It allows light to enter. After that class is what we call our lens. No? The lens. Okay? The lens is a flexible structure. Flexible structure, meaning it can change its shape. Okay? Its main job is it focuses light onto the retina. It focuses light onto the retina. It works like this, ngani. If this is the eye, the back part of the eye nga dapit sa likod, na diha ang atong retina. Now, our retina, no? Let us discuss it further sa our retina. It is the innermost layer of the eye. Innermost layer. Okay, it is the innermost layer. It contains what we call photoreceptor cells. Okay? It contains photoreceptor cells. Specifically, our rods. Okay? Our rods and cones. Okay? Specifically, our rods and cones. Now, it works like this, manggod. Let's say, for example, class, the amount of light is very small. Kana. Very small. Okay? The amount of light that is entering the eye through the pupils is very small. What the lens will do is it will expand its size. So that when it hits the light, when the light hits the lens, it will refract, no? It will refract or spread the light, and it will make it much bigger. Thus, more of the retina can sense it. Okay? Thus, more of the retina can sense it. That also goes the opposite way. Okay? That could also go the opposite way. For instance, class, ang light na nisud si mong eyes is very big. Dako kay light. Your lens, what it will do is it will shorten its size. Pagamay na siya. It will become smaller. As I've said, no, it is a flexible structure. No? Wait, ba't yung representation? Wait. Yan. See, for example, ana kadaghan ang light, and then, mao ni siya, no? What it will do is it will shorten in size so that when it enters, yapon siya, gamay yapon siya, no? It will decrease the amount of light, no? Thus not overwhelming. Okay? I want you to remember, class, ha? Ang lens, class, its main job is to focus, ha? Focus light. Ang iris is to regulate the light. Ang kining imong pupil, it is allows light to enter. Okay? Sometimes mo good, no? It is very overwhelming, no? Maglisod og memorize ang mga student ani kay daghan ra kayong terms. Okay? After that, class, is what we call our vitreous humor. Now, a vitreous humor is a form of fluid, no? It is found here nga ridapit sa atong vitreous body na si fluid diha. Vitreous humor. Its main job, its main function, ato spell, ha? Asa mo to? Ayan. Vitreous humor. Its main function is to maintain the shape of the eyes. Okay? Its main job is to maintain the shape of the eyes. Okay? So, muna siya, class. So, imagine na lang imong mata, class. Mura na siya water balloon. If there is full of fluid, it will maintain its circular shape. But if it is, let's say, for example, gamay rag fluid, obviously, it will deflate, no? It will deflate. Next is our choroid. Okay? Choroid. Ayan, andito. Okay? Choroid is the layer after the retina or before the retina. Okay? So, if ang retina ang innermost, before that, or superficial to that is your choroid. Okay? Ang choroid, class, very simple, class. It is highly vascularized. Okay? Highly vascularized. This is the one that gives what we call our conjunctiva, its red color. The reason for that is because the choroid is the one that supplies blood and nutrients to the eyes. Ayan, supplies blood and nutrients to the eyes. And lastly, among which, class, is what we call our optic nerve. Okay, kana lang sa, ha? Basic lang sa ta. Optic nerve is very simple, class. It will be the one that transmits visual stimuli to the brain. Okay? To the brain. Specifically, it will send it to our occipital lobe. It will transmit it specifically to the occipital lobe. Okay. Now, next we will discuss our eye muscles. Okay. So, kanina siya, class. In our eyes, internally, in our eyes, we have 6 ocular muscles. The superior oblique, otherwise known as our SO, our superior rectus, SR, our medial rectus, MR, our lateral rectus, LR, and our inferior rectus, IR, and our inferior oblique, IO. Okay. Now, always remember, class, ha? These 3 muscles, these 6 muscles are innervated by 3 cranial nerves. They are innervated, or they are being controlled, no, by 3 cranial nerves. First among which is cranial nerve number 3, which is our oculomotor. Okay? After that is our cranial nerve number 4. It is also being controlled by our cranial nerve number 4, which is our trochlear. Okay, ayan. Trochlear. And lastly, it is also being controlled by our cranial nerve number 6, otherwise called our abducens. Our abducens cranial nerve. Okay? Now, asa man ni siya relevant class? Okay? Ano lang sa basic lang sa where is this relevant? It is relevant here. Okay? Now, tanawak lang sa look at the labels. This is the left eye. This is the right eye. Left, right. Left, right. Now, class. Ingani man guna siya, class. Let's say, for example, the patient wants to look towards this side. The patient wants to look towards this side. Adto pa dong. Okay? The patient wants to look towards this side. Adto ganahan siya mo tanaw dito. Okay? Ganahan siya mo tanaw dito. So they must move their eyes towards there. Now, what say purpose is this? Okay? The right eye, using the medial rectus, will move towards this direction. So, kini siya, mulihok ni siya. And the muscle that is moving it is your medial rectus. At the same time, it is being controlled by our cranial nerve number 3. Okay? So, while our left eye will move towards this direction by way of our lateral rectus, which is being controlled by your cranial nerve number 6. Okay? So, libog siya, no? At first, libog siya, no? But, in terms of assessment mo, here is how we are gonna use it. Okay? Here's how we are gonna use it. Let's say, for example, I am assessing the patient's 6 cardinal gazes. Okay? Kanang asa sila where they can look at or sa ilang movements, ilang eyes. Let's say, for example, I ask the patient to look towards here. Padong dito. Ako sila gipalingi. Now, let's say, for example, ang iyang right eye, it can move easily. Okay? That means, ang iyang lateral rectus sa right eye, and then ang iyang cranial nerve number 6 is good. But, for example, class, if this eye cannot move, kini rin nakalihok ha, kini siya wala. If this eye cannot move, it means that either the medial rectus or the cranial nerve number 3 is damaged. It means that either the cranial nerve number 3 or the medial rectus is damaged. Okay? Do you understand? Ayan. Now, class, next slide no is the optic chiasm. I will not discuss this yet. I will just ako ni siya appeal sa katong discussion about blindness. Okay? Discussion about blindness, which is coming up next meeting. Okay? So, we will proceed with the last slide is our visual reflexes. Now, we have 2. Okay? We have pupillary light reflex. When we say pupillary light reflex, it means the pupils will immediately constrict when exposed to bright light. Diba? It is a protective mechanism that prevents damage to the photoreceptor. So, for example, class, no? If mo ni siya akong mata, class, okay? If this is my eyes, kana, ayan. Okay, this is my iris. Inside my iris, na dito akong pupil. Okay? Now, class, if it is very dark, okay, ngit-ngit kayo, the normal response is that this one, the pupils will dilate. Okay, the pupils will dilate so that more light can enter. Diba, ngit-ngit man kayo. So, we need more light, more information to enter our brain. No? But, class, for example, when we, shine a bright light, kana, pasigaan na to ang mata. When we shine a bright light towards the eyes, the normal response should be that it should constrict. It should constrict. Dapat mo gamay ang pupils. The reason for that is because there's too much light. It might overwhelm our photoreceptors. So, our reflex is protecting ourselves, no? Okay. Yan. And lastly, class, is accommodation. No, when we say accommodation, it is our ability to focus. Our ability to focus. Focus on nearby or distant objects. Okay? Distant objects. Now, our accommodation is being done by our what we call this lens, no, our lens. But there is also a component that involves our pupils. Dahil kalimutan ha, there's also a component that involves our pupils. Now, it allows our eyes to focus on near objects and distant objects as well. Okay? And distant objects as well. This is due to the lens's ability to change its shape / curvature. So, mura na siya nga ni class. If this is your eye, kana. Okay mo na siya. Ayan, mo na siya mong eye. Nadiri sa likod imong iris. Nadiri ang imong lens. Kana. Mo na siya mong mata. Ana, ayan. Di ay. Tutuhon. If this is your eye, kana. This is your iris pupil. Nadiri sa likod. Kaya ang imong iris muscle, kana. And then your lens, kana. No? Sa likod kay imong retina. Now, if, for example, the object is very far, let's say, for example, kini siya kandila. If the object is very far, it means that the eyes need more information. Because layo man kay siya, di ba? It means that the eyes need more information. So what it does is very simple. First is, it will dilate. Okay? First is the pupils will dilate so that more light can enter. Next is that here is the accommodation part na your lens will expand so that the small amount of light or small amount of information can enter the eyes and be spread out into a wide area by way of the lens. Okay? Mas spread out siya. But here is the catch. Ngani na siya. Muna siya nakanindot ani class. Kini. That is our ability to focus on far away objects. But, ngani na siya. When an object is closer or nearby focus na punta doon na kita. Okay? Daghan na kay information. Diba? Karo naman kay na siya. It's very visible na. So, what the eye will do is it will do what? What do you predict? Okay? Kung siyang mata. If this is the eyes, ana, ayan, ana, it will constrict. O gamay na lang kayo ang pupil. It will constrict, okay? Because there is too much information na. Klaro naman kayo, di ba? Okay, it will constrict. And the lens will become smaller in size or it will flatten. So that when it enters, instead of overwhelming the eyes, no? The flat lens will actually just focus it on the retina itself. Ayan. That is how it does accommodation. And with that, we are done with the